So it's quite common for a lot of folks to experience chest pain, otherwise in the technical term known as costochondritis. Again, hopefully I pronounced that correctly, Dr. Ward. But today we're here to talk about that topic. And we have Dr. Ward here with Ward Chiropractic. Hello, Dr. Ward.
Hello, Rob.
All right, so welcome. So folks who are experiencing chest pain, could you talk a little bit about, again, the causes, how it can feel, what they can do to potentially treat it, and also as a professional chiropractor, what you can do treatment-wise to help them?
Absolutely, yeah. And first, I just want to give you props for pronouncing it correctly.
Costco.
Costochondritis. Well done.
I
Your
keep
hard
thinking
work
of
is
Costco. I'm thinking of Costco. I'm like, no, not Costco.
your hard
Costochondritis.
work. Yeah,
I'm
your
going to
hard
stick with
work.
chest pain. All right, there we go.
Your hard work's paying off there. So yeah, so it is chest pain. It occurs in the chest between the ribs and the sternum or the breastbone. So like kind of on the sides of the chest there is typically where people will feel it. It's like a burning sensation. And anytime we think about chest pain, there are some serious things that could be causing chest pain that we want to make sure we rule out first, like a heart attack would be a common one and various lung issues. So just a little disclaimer, anytime you have chest pain, you want to make sure you get that checked out right away, by urgent care at the hospital, just to make sure it's not a heart issue. But most of the folks that come in with costochondritis have already ruled that out through like an EKG and maybe some other means. So that is one way that it's diagnosed. If we know you have chest pain, absent a cardiac pathology, then we start to think about this joint issue called costochondritis. And the symptoms are typically activity related. So it could be chest pain with certain movements, like a pressing type motion would be a common one because that's compressing the joints, or it can be just random, kind of up and down throughout the day. And it's typically an overuse scenario. And it can also occur in individuals with very tight upper backs because in individuals with tight upper backs, the motion that should be occurring in their back is now occurring in the front, and that can cause the inflammation in these joints. So, what are some things you can do on your own to help with this issue? So, one thing we want to focus on would be mobilizing that upper back or thoracic spine. So, I'd be thinking about things like using a foam roller and doing some postural exercises to extend through that upper back area. So, we could put a foam roller perpendicular to our spine, roll on it, and extend over top of it this way to open up that chest area. We could also think about stretching out the pec muscles in like a door frame, kind of opening things up this way. And we could also think about breathing with the diaphragm or our belly rather than with the chest. So if we breathe with the diaphragm, we're going to be putting less pressure through that chest area. So we try to get these folks to breathe with their belly more so than their chest. And then, of course, I'm going to talk about chiropractic since that's what this is all
Of
about.
course,
So,
of course.
for folks where those home remedies aren't doing the trick and it's a persistent problem, we can professionally get in there and mobilize the upper back and ribs with our hands and other tools to get things moving correctly so there's not so much pressure through those joints. And then we can also do some rehab exercises to stabilize those joints in the front. So we're trying to mobilize in the back and stabilize in the front. That would be the goal. And we've had good success with that in the office.
Got it. Well, very helpful. Obviously, to your point, a lot of things could be causing the chest pain, but if it's costochondritis, very insightful tips of what people can do. And of course, if people want professional help, Dr. Ward is available. So, very insightful as always. Dr. Ward, appreciate your time.
Happy to help.
All right, take care. Thanks.
You too.